My presentation is on treating cancer differently than the way we are doing it now. So it's beyond standard practice. We're using, since the tumor is so heterogeneous, and since one example, lung cancer is different from another person's lung cancer, small cell lung cancer, you have to treat these on an individual basis.
Cancer as a disease is omnipresent. It's in India also, it's spread in the entire world. So could you please relate this with the healthcare industry, your area of presentation? What bearing?
Yes, I can. Actually, what we're doing is it's so costly to be on some of these drugs. Example, Herceptin might cost $93,000 per administration. And so what we're looking at is, again, on an individual basis, is using some off-protocol agents such as metformin, which will be one tocamine, which is a diabetic drug. And here it has function in cancer as well as targeting the cancer stem cells. And then another tocamine will be on dichloroacetic acid or dichloroacetate. And that too is off protocol. Actually, they're treating it for lactosis diseases. And we now find that that has function in cancer. So it alleviates a lot of toxicity for the patient and cost for the patient.
Ma'am, what should be the expected take-home or learnings from the presentation that you will be presenting?
Well, my take-home message is multifold. One is I'm hoping that all cancer people will realize that we have to treat cancer correctly the first time. That if we treat it incorrectly the first time, then we are setting the patient up for drug resistance, and then it comes a multi-drug resistance. And so by looking at the tumor like we do in our assay and looking to see what the patient may be sensitive or resistant to, we can at least guide the doctor into knowing what will benefit and be efficacious for that patient. The next take-home message that I'm hoping I'll convey is that I believe, and this is my own personal opinion, that a cure is a little bit of a way off right now, but if we treat these patients chronically and keep them like we do diabetics and other types of diseases, that the patient can lead a full and meaningful life even though they have the disease.
Ma'am, I hope you'll be touching upon, I'm sure you'll be touching upon the innovation and advances in the area of your presentation. So do you think it would actually be affordable and accessible to the general mass?
I know that our assay is. Our assay is affordable. As a matter of fact, we have already looked at if the patient ever has to take money out of their pocket. The second thing is that we also have a foundation, and we hope to never ever have to turn away a patient. But again, how some of these newer advances are in the cost of drugs, I do notice that pharmaceutical companies are participating in that. If a patient cannot afford $93,000 a pop for getting treatment, that they will work with the patient, which I'm grateful for. But I think that we can make it costly, but affordable, but we certainly have to work at it right now.